You're watching News at 10 with me, Brandon Lepong. The public is advised against going for COVID-19 antibody tests as there is still no clinical guidelines issued on the matter. Coordinating Minister for the National COVID-19 Immunization Program, PICK, Khairi Jamaluddin said, based on guidelines issued by the Centre for Disease Control, CDC, and the Food and Drug Administration, FDA, of the United States, as well as in other countries, the test was not recommended. Khairi said there were still no clinical guidelines for which antibody tests that produces accurate results, adding a statement on the matter will be issued by the Health Ministry soon. He said a study on the effects of taking the COVID-19 vaccine on the immune system was being conducted by the Institute for Medical Research, and the outcome of the study will be announced to the public. Meanwhile, on the surge in vaccination rate, with 98% of the adult population in the Klang Valley having received the first dose of the COVID-19 vaccine as of the 1st of August, Khairi said the focus was now on states which showed increasing trend in daily cases. On daily vaccination rate, he said Malaysia now topped the list worldwide, but with the limited vaccine supply, it was difficult for the country to surpass the current rate of 400,000 to 500,000 doses a day. The walk-in vaccination initiative that is being implemented in the Klang Valley will be expanded to public vaccination centres, PVVs, nationwide for special groups soon. The National COVID-19 Immunisation Special Task Force, CITF, said the groups targeted are the elderly, people with disabilities, OKU, individuals with comorbidities aged 18 and above, those who missed their second dose, as well as teachers, members of the implementing group, and contract support staff at educational institutions of the Ministry of Education. Details of the implementation of walk-in vaccination will be announced by the state CITF together with the respective state health departments. This includes vaccination scheduling and daily walk-in vaccination quota at PPVs for each state. CITF said the number of daily walk-ins depended on vaccine supply at the PPV, and for those who did not get the opportunity to get vaccinated that day due to running out of vaccine supply at the PPV, their names would be listed as priority to get vaccinated the next day. The task force said walk-in initiatives for senior citizens had been initiated in Perak, Kedah, Penang, Sabah, Melaka and Sarawak, as well as Kelantan, which requires pre-booking. It said for Klang Valley residents who do not belong to any of the above categories but want to walk in for the first dose in cases of no appointments, they need to go to the PPVs that were listed previously. For pregnant women, CITF said this group is not encouraged to walk in. Instead, will be given an appointment through MySejahtera based on the expected date of delivery to the appropriate PPV. The Melaka State Government plans to implement a COVID-19 vaccination program involving tourism industry players soon. Chief Minister Datuk Sri Sulaiman Mat Ali said the move as one of the initiatives to revive the industry, which has been severely affected by the COVID-19 pandemic. The Chief Minister said that the state government had received a list of tourism players in the state, but the plan required the approval of several parties, including the COVID-19 Immunisation Task Force, CITF, as well as depending on the vaccine supply received by Melaka.
Dia dah mohon kat saya, hotel dah minta, yang siapa ni, industri pelancongan ni pun dah minta. Saya dah hantar nama-nama mereka yang layak, mereka ni, saya dah hantar dah. Cuma kelulusan itu bukan di bawah saya, kelulusan itu di bawah KKM. Begitu juga yang lain-lain.
Commenting further, Datuk Sri Sulaiman said the effort could indirectly help speed up the National COVID-19 Immunisation Program, PICK, and ensure that Melaka could achieve the herd immunity as soon as possible. An open-top double-decker bus that was modified into a mobile vaccination centre has become the main highlight of the Community Vaccine Mobilisation MOVAC outreach program in Felda Jengka 3, Pahang. Abdul Rahman Muhammad, a manager at Elang Was Sendiran Berhad, the company that operates the KL Hop-on Hop-off bus service in the capital, said Felda Jengka 3 was the first destination for the bus, which now houses 7 vaccination stations within. Abdul Rahman said the mobile vaccination program was a double boon to the bus operators, as it does not only help the government speed up efforts to achieve herd immunity, but it also ensures the survival of those who have been badly affected by the closure of the tourism sector following the COVID-19 pandemic.
Okay, kita ada 20 biji bas. Kalau lagi banyak pihak kerajaan bagi kami untuk kami vaksinasi, kita akan keluarkan 20 biji bas lah. Jadi kalau boleh kita nak keluarkan semua bas-bas yang kita ada lah. Jadi kita pun boleh mengambil balik pekerja-pekerja kita yang sebelum ni kita beri cuti tanpa gaji, kita boleh bantu balik ekonomi diorang. Itu harapan kami lah.
Absang. He was met at the program at the Semai Bhakti Hall today with Deputy Housing and Local Government Minister Dato Sri Dr. Ismail Abdul Muttalib also present. The two-day MOVAC program, which begins today, involves 5 buses that were converted into vaccination centres for 1,600 residents from Felda Jengka 3, Felda Jengka 2 and Felda Ulu Jempol, who will receive the Pfizer COVID-19 vaccine. In addition to the MOVAC program, Abdul Rahman said the buses were ready to help with the implementation of the Public-Private Partnership COVID-19 Industry Immunisation Program, PICAS. After 2 consecutive days of setting new record highs for daily COVID-19 infections, over 20,000 cases today fell slightly to 19,257. Health Director General Tan Sri Dr. Nur Hisham Abdullah revealed that Selangor continues to contribute the highest number of cases among the states and federal territories of Malaysia, although its number dropped slightly compared to yesterday to 7,084. Now, this was followed by Kuala Lumpur with 2,450 cases and Kedah with 1,514 cases. The ministry also reported 16,323 recoveries today, adding there are now 224,120 active COVID-19 cases in the country. COVID-19 fatalities in the country continue to rise with 210 deaths reported in the last 24 hours, bringing the total number of COVID-19 deaths to 10,389. Despite the slight drop in daily infections today, the number of patients at intensive care unit remained in the 4 digits. Currently, 1,097 patients are being treated at the ICU, with 575 needing breathing assistance. Dengue cases in all states have recorded a drop of between 20 and 94% this year compared to last year. According to Health Minister Dato Sri Dr. Adam Baber, from January to the 6th of August, a total of 16,565 dengue cases were reported compared to 63,988 in the same period in 2020, which is a reduction of 47,423 cases or 74.1%. He said today in a statement the number of deaths due to dengue till today stands at 10, compared to 106 in the same period last year, a reduction of 96 deaths, or 90.6%. Dr. Sri Dr. Adam said although the country was struggling with COVID-19, the prevention and control of infectious diseases, including dengue, have not been neglected as such. Oversight would cause all gains made to be lost in an instant. According to the minister, there is no effective vaccine to protect people against being infected with dengue as yet, and as such, methods that have been proven to be effective against it must be continued. Therefore, full commitment and cooperation from local residents, local authorities, companies, non-governmental organizations and volunteers from the Communication for Behavioral Impact program were greatly needed to tackle the issue of cleanliness, especially in residential and That concludes today's news at 10. In our top story, nationwide walk-in vaccination rolled out to commence soon. Tune in for more updates tomorrow. Till then, I'm Brandon Lepol. Stay tuned to Saluran Berita RTM. Stay safe and good night.